Hello, my name is John Hathcote, and I'm going to talk about how we can use implementation fidelity assessment to inform evidence-based decisions about educational programs. So to give you a little bit about my background, I'm an assistant professor in graduate psychology and an assistant assessment specialist in the Center for Assessment and Research Studies at JMU. Though I've taught various courses in the past, I currently teach graduate level courses in measurement theory and performance assessment. As an assessment specialist, I work both in general education as well as in student affairs. So this, at least in part, involves acting as a faculty coordinator for student affairs assessment services or support services, what we refer to as SASS. And this basically consists of a team of graduate assistants who basically provide consultation to student affairs practitioners. Heather Harris is a student coordinator of SASS who's also a first-year doctoral student. She also did her master's here, and she's going to assist me with the presentation today. Actually, she's not going to assist me in this recording, but this is actually part of a webinar. And during the actual webinar, she will be assisting me with it. All members of SASS have contributed to this presentation, so I'd like to acknowledge them as well. So since this is not a video recording, I thought I would go ahead and put some faces with the names. I'm on the left there, followed by Heather Harris, who's our student coordinator. The other member of SASS is Derek Sauter. He's a first-year master's student, followed by Madison Holzman, who is a first-year PhD student. I'd also like to give a special acknowledgement to Sarah Finney. Sarah is also a professor here at JMU in our master's and PhD program. Much of her assessment work involves student orientation programs, and basically this presentation would not exist if it were not for her insight when working with student orientation. So I'm going to talk about this in more detail as we proceed, but for now I'd like to say that basically the concept of implementation fidelity within educational assessment exists primarily because of her research. So today I'm going to talk about, first we're going to really talk about the role of truth and evidence within educational assessment. This will basically lead to what we refer to as a black box of assessment practice. Implementation fidelity, which is basically examining whether the administered program or the program that students actually receive aligns with the intended program or the program as it exists on paper. And this information basically allows us to probe the black box. We will then give you some strategies for assessing implementation fidelity using a student affairs program as an example. And we will then show how this information can be used to provide diagnostic, if you will, diagnostic data that's going to basically indicate or pinpoint what aspects of a program we need to improve. Finally, we're going to discuss how does this assessment, how does implementation fidelity assessment fit within a typical assessment cycle. So let's begin. So I think that due to technological advancements, we live in a world where we have easy access to information or data. And though one issue, there are various issues that this creates, but one issue is that this access can result in information overload. An additional problem is that we basically need skills. Skills are needed to identify the extent to which information is deceptive, right? To what extent can we trust this information? So, unfortunately, deception can be intentional or unintentional, but nevertheless, we're called to sift through information to make the best decision that's possible. So if you look at these are just some very quick examples of how this works, how this could work. If you look at the picture on your left, this seems like a very nice vacation spot. Perhaps these two people are taking a honeymoon or something along those lines. And now, if you look at the picture on your right, taken from nearly the same spot, the picture does not seem very nice, does it? So perhaps this is a bit deceptive. Another example, we see this pool here. It looks pretty neat, if you will. It looks like these three people, who are all different ages, they fit in the pool very nicely. They're having a very nice time in it. But when we examine the same pool, once again, you see that this girl is not nearly having as much fun as the other three students. So perhaps this original picture is a little bit deceptive. And if you actually look at the picture on your left, you can actually see some areas where it's been photoshopped and so forth. So for example, the blonde girl in the pool on the far left, her legs have been partly removed. There's just simply no way that these three kids could fit in that pool, at least in the actual pool. And, you know, the other thing is, you look at the picture, the second picture, the child on your right, she's seemingly a lot younger than them, and I suppose in reality she's a bit probably smaller than some of these children. She's having difficulty getting in this pool. So what is this, these couple examples, what do all of these things basically imply? Well, I think that these examples suggest what I'm going to refer to as a need for healthy skepticism. So in some sense, skepticism has both, let's say, positive and negative features. For example, we should question claims and the extent to which evidence would support a claim. However, I can take skepticism to an extreme, and if taken to an extreme, it would lead to some kind of, let's say, some form of stagnation. So in other words, I can become so skeptical that I refuse to act on evidence. So when I talk about healthy skepticism, it's really an effort to kind of balance both of these ideas. So in other words, we should persistently question whether evidence supports a claim, but we need to do this in such a way that that we can ultimately avoid stagnation. So with respect to assessment, we should question how evidence supports judgments about an educational program. However, we should also recognize that all assessments, just like all research, is in some sense flawed or problematic. There's limitations with these things. So at some point, we must recognize as well that evidence is good enough, right? It may not be perfect, but it is at some point good enough to act upon. Okay. So let's talk some about the relationship between evidence and truth. All right. So when we think about the distinction between evidence and truth, and we can say, well, does evidence in support of X or support of some claim indicate that the claim is true? And I think that the obvious answer to this would be no. And I think a simple way to think about this is through, wrongful convictions. And I'm not sure if you can read the quote, but this is a quote from a Supreme Court justice, I think, in Florida. And it says, anybody who understands the justice system knows innocent people are convicted every day. So, as I've mentioned, evidence, unfortunately, can at times be misleading. So there may be a lot of evidence to suggest that this person is guilty of some crime, but in reality, for whatever reason, this evidence has led me to the wrong conclusion. This can also be the case in educational assessment, right? So assessment data I'm throughout this presentation, we're going to argue that without implementation fidelity information, in fact, it often may, let's say, lead to conclusions that we would deem inappropriate or perhaps wrong about the quality or, let's say, effectiveness of an educational program. So with respect to educational programs, there's generally two different possibilities, right? So first, it's possible that the program is effective. In other words, participating in this program will result in valued student learning outcomes. Second, it's possible that the program is simply ineffective, right? So for whatever reason, this program does not lead to the outcomes, and we're going to, what our aim is we need assessment data, and we're going to use this data as an indication of which possibility is more reasonable. Now, technically speaking, there's a third possibility. The third possibility would indicate that the program is in some sense or in some way conditionally effective. So in other words, the program may be effective for some students, but not others. Perhaps an educational program or some form of counseling treatment, let's say, is more effective for females as opposed to males. But even though this is technically a possibility that we need to consider, to keep matters simple, we are going to simply set that possibility aside. And we're, throughout this presentation, going to assume that in general a program is either effective or ineffective. Okay, so when we're making decisions about educational programs, and we're also thinking about the relationship between evidence and truth. So whether the program is really effective or not, and I'm making a decision based upon data, there are two types of errors that we can make, and you're probably familiar with these errors from, say, an introduction or a basic statistics course. So the first error is a false positive. So that's the type 1 error, and here you see a picture of the doctor telling this man that he is pregnant. So when in fact he is not pregnant. With respect to educational programs, a false positive would occur if we conclude that a program is effective based upon this data, but in reality it's generally it fails to be effective. The second would be a false negative. So here we have a doctor on the right-hand side basically telling this woman, who obviously looks to be pregnant, that she is in fact not pregnant, right? With respect to educational programs, a false negative occurs when we conclude that the program is ineffective. So we don't think the program is effective. We may change it or abandon it, but in reality it's actually effective. Now, from what you may remember in statistics courses, there's a lot of things that we need to consider if we want to minimize one error as opposed to the other, and so forth. However, I'm not going to address the statistical side of this, and what we will suggest throughout this presentation is that in addition to those types of considerations, these errors can in part be minimized by collecting implementation fidelity evidence. Okay, so far we've basically said that evidence is at times misleading, and that it can lead me to make incorrect decisions about educational programs. These can either be a false positive or a false negative, and that I have suggested that implementation fidelity, getting that kind of information, can help us minimize these errors. So now we're going to actually take a look and see how this would actually work using some simple examples. Okay, so believe it or not, I mean, I guess this information was a bit shocking to me at first, but I'm not a veterinarian by any means. So believe it or not, cats actually can suffer from anxiety issues or other psychological issues. And there's actually a medication that's very similar to what we would prescribe to people for cats with anxiety issues. So in this case, let's pretend that we're a veterinarian and we've prescribed a medication that's been well studied, for anxiety. And this medication should be taken every day for the next 2 months, and they're going to come back to the office and we're going to evaluate these cats, or a cat. So let's say that 2 months will go by and this is what we see. Our patient returns and the cat looks like this. what should we do in this situation? What should we conclude in this situation? And should we contact the developers of this medicine and say, look here, this medicine simply did not work for this cat. Now, I think it's very tempting to conclude that the medication is simply ineffective in this situation. But is this conclusion appropriate? And as explained very shortly, this conclusion requires us to make a critical assumption. What if we see this? Well, the cat comes back. 2 months later, the cat comes back, and what should we think about this cat? And I think, wow, I look at this cat, and I think, man, this anti-anxiety medication seems to be working like magic, and I think, well, maybe I need some of this medication. So anyways, should I conclude that the medicine is working? And like I said, this conclusion is problematic because of one critical assumption that we currently don't have evidence about. Here, we've been prescribed medication, but in this case, the person is simply too afraid to take the medicine. So in other words, we need to know whether the medicine was taken by the cat as it was prescribed. So for example, if we have a person here with a similar condition and they didn't take the medicine as prescribed, how can I make conclusions about the medication and whether this medication seems to be working for the person or not if they failed to follow our treatment recommendations, if they did not take the medicine as we have intended? And simply put, it's very sketchy, if you will, or shaky to make these conclusions without knowing, in fact, whether or not the person was taking the medication as prescribed. So as a doctor, what the patient is doing at home is basically a black box. Now, if you want to kind of illustrate this black box, it's very similar what we have in educational programs. So let's see how this could work. On the left-hand side, you have our kitty who is entering a program and being administered some type of treatment. The cat comes back 2 months later, and this was our result. And what the kitty cat did at home was not known to us. So that is basically the black box. Implementation fidelity assessment basically will probe this box to investigate what's happening at home. Did the kitty cat take the medicine as prescribed? Now, once we probe this box, we can see that sure enough, our kitty cat has in fact been taking the medicine as it was prescribed. And this is going to help us justify the inferences that we're wanting to make about the effectiveness or ineffectiveness of our program. Now, this is very similar to what we experience in educational assessment. We have students prior to participating in a program. Perhaps they are administered a pre-test of some kind. These students participate in a program that is purposefully designed to give them an opportunity to meet these outcomes. And all of this, what they actually do during the program is a black box. It's basically knowing we see what the program looks like on paper, but we really don't know what's happening once the students are in the program. Did things basically go according to plan or not? And this information can help us kind of pinpoint areas of weaknesses and so forth. So, as I mentioned before, this is kind of what happened to Sarah when she was doing some assessment work with student orientation programs. So some of the programs, the objectives or outcomes for those programs were not being met, and things looked really good on paper. So basically the question, well, why is this happening? We seem to have a good program. We don't understand why these students are not responding in a certain way. So why might this be the case? So basically, Sarah became kind of a detective, and she basically would pretend to be a student without anybody knowing. She sat through student orientation as if she was recently admitted, And then she simply watched the program. She knew at the time what was supposed to happen on paper. And basically there were certain things that they were aiming to cover, or they intended to cover, but it never happened. And she has said, that when she saw that stuff, she could predict basically what outcomes would be problematic simply because they were not covered, or they were not covered very well. So, students, we want to, like I said, make conclusions about the program as it has been developed, or the program as it exists on paper. However, unfortunately, students cannot be influenced by good intentions. Students are influenced by what they actually encounter or experience when a program is administered. Implementation fidelity assessment basically examines whether the program on paper, or the intended program, matches the program that students actually received. Now, we will walk through some strategies for basically how we can investigate this using a substance abuse prevention program as a simple example. We've kind of tweaked this some because to make it more simple here. So what we're going to do, we will walk through these 5 different aspects of implementation fidelity, and as we're walking through this, you'll be provided with a table that will allow for you to assess it. So basically, the first thing is program differentiation. Basically, what are you doing in the program to provide students with an opportunity to meet these outcomes? You should already have this information whenever you're mapping or developing curriculum to meet student learning outcomes, or to meet objectives. So basically, there should be, at least in theory, very specific things that you are doing to give students an opportunity to meet these outcomes. Adherence is basically asking the question, well, did these things happen? Quality looks at how well these things were administered. Exposure can be an issue or not, depending upon the context of a situation, but if it is an issue, exposure basically deals with the length of treatment, and responsiveness is concerned with student engagement. So let's begin with program differentiation. So here we have, like I said, a substance abuse program. And let's say that one objective of this program pertains to self-reported alcohol use. So after completing this program, students should report a decrease in, say, on average, let's say, of 3 drinks per week. Now, what are we doing to meet this outcome? Well, the facilitator is going to lead a discussion about drinking behavior. Well, what is going to happen in this discussion that should lead to this decrease? Well, they need to do a couple things. One, they need to review their average BAC levels that's obtained from a specific report. So they'll have a conversation about these BAC levels. They're also going to discuss perceptions about the student's own drinking and how this aligns with normative drinking behavior, and even have discussions about what is normative, what the student thinks might be normative. And there actually tends to be a lot of misconceptions about that, but that's a side issue. Okay, so did these things actually occur? That's a part of adherence. And I think one way to think about this in educational terminology is to think, well, did students actually have an opportunity to learn the material? So students, for example, cannot be expected to know, think, or do something if they were never given an opportunity to learn this information, right? It seems pretty straightforward, so we need to ask, well, did these things happen or not? So we can simply add a column, and we've added adherence to the table as a column here, and adherence is basically examined, or you can examine it by simply yes or no. Did these things happen? So perhaps we did review the BAC level, right? But for whatever reason, we didn't have time to talk about their perceptions about drinking norms, right? So we would indicate yes or no for each of these things. Okay, quality deals with how the program was actually delivered. So basically, quality pertains to how the program was delivered. Was the content clear? Did it seem confusing? Etc. There's a quote here. I don't really like reading quotes, but basically we're looking at, preparedness, effectiveness, and so forth, but oftentimes this comes through as clarity of the content. And so let's see how that would work. So I know when we've done this, we basically look at quality using low, medium, or high, at least to have something to rate it by, but we also want people to add comments so it's very clear what we mean by it. 1, 2, or 3. So here we've gathered some quality ratings to our table. So in this case, both features of the program, they did occur. Quality is rated on a 1 to 3 scale with higher scores indicating more quality. But since, like I said, people have different interpretations of these scores, we also recommend for people to leave comments to explain their ratings. So in the first case, the discussion of BSC was rushed and perhaps it suffered in clarity. In the second case, the information seemed more clear. So a common question that we face when we're thinking about quality pertains to faculty. Would we worry doing this that faculty feel like they are being evaluated? Well, if they feel like low quality ratings reflect somehow self-inadequacies, let's say. And I think that, well, obviously this can be a concern. And I want to emphasize that quality is not meant to be an indication of faculty, effectiveness, or faculty, some kind of use to judge or evaluate faculty, or an indication about their skills or something. As we're going to discuss a bit below, or a bit here in a minute or two, it's possible to have program coordinators collect this information about themselves, and this would be a strategy that we could use to alleviate some of that fear. Okay, so exposure. Exposure basically pertains to the amount of time that we take. So for example, some programs may require students to attend multiple sessions or complete multiple assignments. Programs may also be defined by the length of a particular session. So for example, perhaps for some theoretical reason, a program should last for so many minutes or so many hours. Exposure was not really a concern with the substance abuse program, the way that they've actually admit in our situation, but there may be situations in which it is worth examining. So things do not necessarily go according to plan, and perhaps let's say that exposure, the program was interrupted by a fire drill, excessive snow, or absences for some other reason. So how could this work in our example? In our case, like I said, so let's say exposure could be an issue if for some reason treatment consisted of multiple interviews or multiple sessions. So the student, let's say, they were asked to complete 2 separate interviews. They arrived for the first interview, but for whatever reason, the second interview was canceled. Now, someone may wonder, well, how is this information different from adherence? So adherence and exposure are not necessarily the same thing. So for example, perhaps we did review their BAC levels and we started on this, so we adhered to it, but for some reason it was interrupted during the session. So in other words, there is a distinction, and sometimes it's beneficial to make that distinction between whether we have done something and the expected duration of that something. Okay, now finally we need to look at student responsiveness or engagement. So in other words, I may have done what I intended to do, and this may have even been at a decent level of, let's say, quality, but this really doesn't matter if the students are simply unengaged. For example, despite my best efforts and the quality, the clarity of the content and so forth, students who are sleeping simply cannot be expected, or they're texting or whatever the case might be, they cannot be expected to meet an outcome. Okay, so we need to look at student responsiveness. So in this case, we've added responsiveness to the checklist. This is rated on a similar scale as quality, with basically higher scores indicating greater responsiveness. And I had to kind of tweak this some to make it fit on the PowerPoint. But let's just go through that. So let's say that with respect to BAC levels, they were discussed, but this was done in a very rushed manner, and the discussion may have suffered in clarity. However, the student was highly engaged, let's say, despite these problems. I'm just making these things up. Let's say in our second example, the second thing about this second feature of our program, where we're talking about drinking perceptions and normative data and so forth. This was done, let's say, in a clear manner, but for some reason the student tended to be on their phone throughout the session. They didn't seem to really be paying attention or texting. In both cases, this is giving us evidence that makes it unreasonable for us to expect our student learning outcome to be met. Okay, so how do we get this data? You've been provided with a checklist, a table. So how can we actually get this information? Well, there's a few different techniques that we can use. One technique, which is perhaps the most simple, is to simply have the facilitator complete the checklist after they administer a program. It's also possible to have students complete the form to provide additional information. This strategy is perhaps the most efficient strategy, but as you might imagine, there are some situations in which it could lead to bias or whatever. People may, for some reason, be afraid or embellish their ratings. So that would be a limitation of this technique. So you need to provide some assurance that that these are not used in some punitive way. As we mentioned in our discussion of Sarah, it's also possible to have an external person observe the program. So this could be done with or without the facilitator's knowledge. So in this sense, the ratings would seem to be a bit more objective, or at least not, the external person may be less likely to want to embellish the ratings for some reason. So it may be more objective, so to speak, than self-report, but it is resource intensive. So you may need multiple observers who are trained ultimately to use this checklist. A third option would be audio or visual recordings. So recordings, would have a benefit or an advantage of allowing us to review something multiple times, so we could facilitate. This would basically ensure or help to facilitate more accuracy in our ratings. But in many cases, this is simply not feasible. Another kind of disadvantage would be people may react differently when they're on camera. And sometimes just knowing that you're being observed, people will act differently. But then, I don't want to go into all that, but does that really matter if it basically involves you facilitating the program in a decent way? So those are three techniques, some being more resource intensive than others. So how can we actually use this information? So at this point in the presentation, you've already got a decent idea, I think, about how we can use this information. First, we're basically assuming that instrument development is a non-issue. Instrument development, the test itself, is a different thing from implementation fidelity. We are basically assuming that you've already handled that. So you have an assessment instrument of some kind that's pretty much complete. And even though there's no perfect instrument, you think it's decent enough for you to act upon. So we're assuming that that's a non-issue. Second, and what I've already kind of implied, is that we can use this information we're wanting to make judgments about the planned program, right? This is a program that's been developed according to theory, or according to something, right? But we have a reason for doing the things we do. So we're interested in making decisions about the program on paper, since this was previously developed with the intention of giving students an opportunity to learn. Fidelity information is basically used in conjunction with outcome assessment data to make judgments about program effectiveness and basically identify areas for improvement. So let's take a look at how this can work. So how can we interpret implementation fidelity in conjunction with outcome information? So if you look here on the X y-axis, we have two situations where one on the left-hand side is low fidelity, and on the right-hand side, we have situations that are high fidelity. So everything in the right-hand column, we're assuming that fidelity is good. Everything in the left-hand column, we're assuming that fidelity is not that good. Okay, so what do we have on the right-hand side? Right? We have everything on the right column indicates high fidelity, so this is all high fidelity, like I said. Things on the left here will indicate low fidelity. Now let's take a look at the y-axis. And the first here, so here we have down below, well, really, let's just start with that on top. In this case, our outcome evidence is favorable. So everything in the first row would indicate a favorable outcome. The second row would indicate an unfavorable outcome. So basically, we have four different possibilities within this table. A situation where an outcome is favorable with low fidelity, favorable with high fidelity, unfavorable with low fidelity, and unfavorable with high fidelity. So basically, this is going to leave us with four different possibilities. And here I've just kind of labeled these possibilities. So let's begin with a favorable outcome and low fidelity. So in this case, students did well in the program, at least according to our measure. However, the program was not implemented as intended. Well, unfortunately, in this situation, we cannot claim that their performance was due to the program as it existed on paper. However, if we have good performance, now I'm moving over to the second column in the first row, and high fidelity, this is indicated by, so it would be more reasonable to attribute the success of the program to the treatment as it exists on paper. So what if we have unfavorable outcome results? So for whatever reason, the students didn't meet our outcome according to the measure. In the first case, in our first case, the students did not perform well, but the program was not implemented as intended. However, in this case, the program may actually be affected if it was implemented correctly. So basically, we don't know in this case, even though students didn't meet the outcome, we really can't attribute that to the program as it exists on paper because we didn't administer the program as it exists on paper. So we need to replicate this and replicate the study, but make sure that people are trained better or whatever to implement the program as it was intended. So let's say that we also have an unfavorable outcome with high fidelity. Well, the program was implemented as we wanted it to, but the results were simply not favorable. Well, this is actually really useful information because it can allow us to identify what specific features of a program need to be changed. So this is actually not a bad thing. So how would this work, right? So let's kind of work through a simple example. So if we want to discuss blood BAC levels, and we think this discussion is going to lead to less self-reported drinking, let's assume that we have high fidelity information. So we did what we wanted to do, and this was done in a clear way, students are responsive, and so forth. If students are still drinking the same amount, then we obviously need to do something different in the program. So what could we do that were different? This is the circle on your left-hand side. Students are still drinking the same. So we could either add something to it. So perhaps we'll discuss, well, I should say, if I want to stick to the left-hand side, perhaps we could replace BAC, that conversation, with something else. Maybe we could talk about social consequences instead of BAC. The other option would be to add something to it, right? So in addition to BAC, we're going to increase our treatment, so to speak, and also talk about social consequences during that time. So we can either modify the program by replacing that specific feature or add something to it. Okay, now what if the students are actually drinking less? So we administered the program, the way that we intended, students are drinking less. Well, in this situation, I'd say that's great news, and you could simply continue to do what you're doing and monitor that to see if you need to change it over time. But I would just continue to do what you're doing in that case. Okay. So now we've introduced implementation fidelity assessment. It's time now that we're going to talk about placing this with a general outcomes assessment cycle. Now I know that there are numerous versions of this cycle that you can choose. This is a version that we use here at JMU. And irrespective of what cycle you actually use, most of them have some very similar features. So most are going to look something like this. So obviously, if we're, let's say, developing a new program, we need to articulate the outcomes or objectives for that program. And then we basically create the program in such a way that it allows us to meet these outcomes. So basically, each outcome is going to be mapped in the second phase of this cycle to a specific program component or feature. At some point, then, we need to select or design an instrument. How are we going to measure these objectives? We need to take care of that process, which would include, collecting validity information and reliability information and so forth. So we, found a good instrument. Well, let's go out and we need to decide some more about the research design, or, what methods are we going to use. We need to analyze the results. And in the ideal world, this is all done with the intention of using the information to make improvements to the program itself. So then the question becomes, well, where would we fit implementation fidelity evidence? And we would fit it right around here. So we believe that implementation fidelity would be at some point after instrument selection. It doesn't have to be necessarily, or right around there. So in other words, we can gather fidelity evidence, let's say prior to or even in conjunction with collecting other information, such as outcome information. Okay. So let's kind of wrap things up at this point prior to taking some questions. So if we notice in the cartoon, the students are wanting to send text prior to being taught their ABCs. If we are interested in assessing texting skills, well, we obviously need a way to measure this. So let's say that we've developed some measure or some performance-based assessment even of texting skills. So in many respects, right, it's probably a waste of time and resources to assess texting skills if students were never taught their ABCs. We don't really need to assess something like that, right? Within educational assessment, what's happening in the classroom or what's happening in there about what students are actually doing, even though we supposedly taught them their ABCs, we don't know that typically. This is a black box, right? We don't know what's happening in the program itself. And as we've mentioned, implementation fidelity assessment basically tries to illuminate or shed light into this black box by collecting information about what's actually happening when a program is administered. And as we have suggested, this is crucial for making judgments about program effectiveness. So, judgments, educational stakeholders are interested in making judgments about the quality of educational programs. Various stakeholders exist who would like to make judgments about these programs, and even students themselves are our stakeholders in these programs. We should be cautious, and I think one of the themes of this presentation is that we need to be cautious about attributing outcome results to a program, basically saying that the reason we see these results is because of a program, if we are unsure about whether the program was implemented as intended. Now, in other words, we often do make these judgments, right? But it requires us to make assumptions about the program being implemented as intended. So if you want to make judgments about program quality or effectiveness, then you must be at least willing to assume that the program was implemented as intended. We've also, however, instead of assuming this, we can actually go in and get that information. So we've discussed some techniques for assessing implementation fidelity. You can get this information by creating a simple table that's really an extension of your curriculum map. And you can complete that table using, at least as far as we know, 3 different methods. Self-report, you can have external observers, or use some kind of recording device. All of these methods have strengths and limitations. A major benefit of this information, however, is that we can diagnose or perhaps target what specific features of a program need to change. So if fidelity is generally low, we need to replicate that and administer the program as it appears on paper. If fidelity is high, we can see what specific features of a program were adhered to, the quality of that information, and so forth, and then use that. If we're doing exactly what we think we're supposed to do, the quality is high, and so forth, well, we need to do something different if the outcome information is unfavorable. If the fidelity information, once again, if it's high, we're doing what we think and the outcomes are being met, well, great. At this point in time, there's no real reason to change the program. But once we know if specific features are being met or adhered to or not, we can basically see what features need to change based upon the outcome results. Okay, so at this point, I hope that you have enjoyed the presentation. There's a list of additional resources. I've also, feel free to contact me if you have any questions about this. Feel free to check out JMU's website, and at this point I would typically open it up for questions, but for the recording I will simply let you go. Thank you.